Hello, everyone. Today we are going to talk about anticoagulant medication known as warfarin. Another name for anticoagulant medication, warfarin is Coumadin. Coumadin is the brand name, while warfarin is the generic name. Coumadin, for the purpose of this lecture, I will be using both of them interchangeably. Coumadin or warfarin, like I rightly stated, it's a blood thinner. What are the reasons why people are putting on a blood thinner? One of the basic reasons is people that to prevent them from having a venous thrombosis or PE. You also put it on patient who has AFib or heart valves, and patient with IM or MI, sorry, not IM, MI, DVT, pulmonary embolism, which is PE. So this medication are put on this patient for this purpose to help prevent clotting or heart attack or stroke. For example, patient with AFib, what happened in AFib, the heart is quivering, like somebody who is cold is just quivering instead of beating the lap dub, like how every normal heart beats. The heart beats, it quivers. So in that case, when this heart is not beating very well like it's supposed to, this patient is at risk of heart attack or stroke. And to help prevent it, the doctor or the patient is usually put in a medication called anticoagulant. There are so many types of anticoagulants. We have heparin, we have Levinox, we have warfarin, and so many of other Plevex. There's aspirin. No, aspirin is like an antiplatelet. So there are so many of them out there. But today, for today's lecture, I will concentrate on Coumadin, which is also known as warfarin. So the first thing you do as a nurse, or one of the actions that you take as a nurse when you have a patient that is taking anticoagulant, is take their vital sign, look at patient history, and look at their labs. For patient who is on anticoagulant warfarin, we have to monitor their vital sign. The basic reason why we are monitoring their vital sign is to make sure that this patient is not bleeding. One, when a patient is bleeding, there is an elevated heart rate and there is a decreased blood pressure. So patient's vital sign will be monitored. Patient PT and INR will be monitored. It's very important to be monitored because what does the INR and the PT level tells us? It tells us how far this blood has thinned. It tells us about the clotting factor that we have in the, like the INR, we have INR is between 2 to 3 is the normal, and the PT is 18 to 24 seconds. So when this INR exceeds 3, it gets to like 4 or 5. Sometimes the doctor ordered this medication to be on hold, either for a day and resume, or sometimes the doctor decreases the dose for this medication. And so it is very important because we don't want our patient to bleed out. We have to monitor this INR, and if the doctor usually sets a standard for the INR, like some valve will say 1 to 2, or heart valve, I've seen one that is like the parameter that the doctor put in is like 1 to 2 or 2 to 3. So between that range. So when the range is higher or lower, we always have to call the doctor. We always have to notify the doctor about this lab level, because what that lab level does is to help the doctor to dose this medication for the patient. So another thing you need to know as a nurse or for the NCLEX is what is the antidote for vitamin for Coumadin. It is called vitamin K. So vitamin K is an antidote. Say the patient had an overdose of this medication, he swallowed in the morning, or is a confused patient and he kept swallowing, some kind of confusion is home, nobody's monitoring her medication. So patient swallowed this medication and had overdose of this medication, and you find out that patient has been taking this medication. What is the medication you expect the doctor to order? That is one kind of question that NCLEX like so much. So the antidote for heparin, for Coumadin, not heparin, for the antidote for Coumadin is vitamin K. And there are some diet caution that patient who is on Coumadin should be careful or avoid. These diets are like dark green leaves, vegetables such as spinach, lettuce, cabbage, broccoli, sprouts, mayonnaise. Then we have canola and the soya bean oil. They can decrease the anticoagulant effect on the body or of the medication. It can decrease the effect of the warfarin. So this diet are necessary. They're important for you to understand, because NCLEX like questions like what kind of the diet will patient taking anticoagulant or taking warfarin need to avoid. So I just listed some of it here. These are the diets that the patient need to avoid. So when patient has a surgery, when patient has to go to for any kind of procedure, even if it's dental procedure, surgery, the first thing is that you have to notify them they are taking this medication. Secondly is that patient has to stop this medication at least 48 hours before any procedure is done. And they have to be aware of that. The things they also have to monitor is about bleeding is they have to monitor the teres too. They have to monitor back pain if the patient continue to experience back pain or lumbar, or discoloration of the urine. These are the things you need to monitor as the nurse taking care of this patient. So can patient go over the counter and buy any medication and start taking it? No. Patients should not take medication over the counter except they check with their primary care physician. It is very important that they do not just take any medication over the counter, because some of this medication can be interacting. Over the counter medication, make sure they do not, even if they have one, they do not contain aspirin. What is aspirin? Aspirin is an antiplatelet. So we need to make sure that this patient is not taking any of this medication and they need to see their doctor. These labs need to be drawn every month to be able to see how the patient is doing and what level is on, whether the medication need to be increased or the medication need to be decreased. So it needs to be done and the doctor needs to be notified. Okay, so so far, I think I have covered most of the things that NCLEX like so much when it comes to medication like Coumadin. You want to know about the diet, what diet would the patient avoid. The NCLEX want to know about the antidote. What is the antidote in case patient has an overdose, which I told you is vitamin K. And you also want to know what is this medication used for? What kind of lab does the patient you need to monitor? PT and INR. INR should be between 2 to 3, and the PT should be 18 to 24. Thank you, and I wish you all the best of luck, and I'll see you next time with another topic. Bye.